spotlight on mental health, something that's evolved from a whisper to actual dinner table conversations. A number of startups as well as non-profits now are actually looking at this space closely. So let's understand the dynamics of the sector as a whole. And we've got Sharad, my colleague, standing by to tell us a little bit more about players entering this space. Sharad.
Well, yes, the preventive healthcare known as mental healthcare has also gained prominence post-COVID-19, and now even the startups and corporates are addressing this burning issue. Now, the important thing is there might be multiple reasons for it, but at the end of the day, we are human beings and mental health is a very important topic. Now, do remember, what do the startups do in this case? And of course, they are accessing data. They are also giving you emerging AI tools. Apart from that, they also strive to provide two important things. One is the accessibility for everyone and also the affordability, as there is always a social stigma attached, as well as people think that therapy is expensive. So this is what the startups are trying to solve, and let's look at the numbers, but how the potential total addressable market size can be there. And of course we bucket it across adolescents, adults, as well as elderly, and now this is spread across your offline online therapies as well as your cross-selling of physical products. Now let's looking at it, $700 million sizes for adolescents, but the chunk coming in between the age of 20 to 64 at almost $2,200 million, and India's largest total addressable market size for this mental health industry would be coming rough to $3 billion as per the report by Bloom Ventures. Now apart from that, there are key startups also operating in the mental health startup space, and they includes Visa, where the qualified therapists are there. Anonymously, they are actually offering support services. MindClient is actually curating the resources for the mental health, while eSci Clinic is also an online mental health care service provider. Apart from this, there is also Alternative Story and Level Up, kind of giving a strong contribution to the Indian mental health care space.
Burnout, anxiety, stress, depression, insomnia, work-life imbalance. Well, over the last decade, our generation has seen the words mental health and those that are related to it evolve from just a hushed whisper to dinner table conversations to even looming large on billboards. India has also seen a plethora of startups that are addressing mental health in a big way. Joining me today on the show is Rashi Vidyasagar. She's the director of the Alternative Story, which is essentially a startup that provides mental health services that are affordable. Thank you so much, Rashi, for taking time out. And that's just really something that I'd like to talk about. The fact that at one time it was such a taboo, something that was perhaps not even properly understood by the global as well as the Indian diaspora. Are things really changing now for people to wake up and take cognizance that things really need to be addressed when it comes to a person's mental health?
I do think they're changing, to be honest. I don't know how much, but I think every step in the way towards acceptance is a great thing. So we are changing. I would like to believe so.
So have we now seen the demand and for a lot of these kind of mental health startups really picking up? Are there a lot of people that are reaching out? Can you just walk us through what the Alternative Story is and how it works for someone who wants to reach out?
Absolutely. So I would just like to start off by saying that the demand is really, really high. A Lancet study said that 1 in 5 Indians will have a mental health issue at some point in their life. And that's a really huge number if you even go by our population. And the mental health services in, comparison to what we have right now are very, very little. So the demand is extremely high. The quality services that exist are also really, really low. We exist somewhere in between a lot of the services. So while on one hand, you have government services, which would be hospitals, district hospitals, which would give you free services, but you might have to wait for hours in line, versus you have extremely high private practitioners that charge upwards of 2,000 to 3,000 to even 5,000 rupees a session, which is really unaffordable for a huge pocket of our society. So we exist somewhere in between. So we're a social enterprise. And if anyone who wants services just needs to place a call, just needs to go on our website, and a qualified therapist will be available to you to give services almost sometimes even on the same day. So we're not a helpline. We do not give services immediately, but we do kind of function as on an appointment basis for sure.
So, just to understand it a little bit better, the journey of someone who is seeking mental health care, is that very similar of anyone in other therapeutic areas, like a risk assessment, some sort of a diagnosis that's given, and then a treatment which would include therapy or cognitive or lifestyle changes, cognitive behavioral therapy? And, do therapists via your company offer the same?
So we do a mix of a lot of different things, but we are a little bit different because we do not believe that mental health alone is only a biological phenomena like any other disease. We are, mental health in our country, especially like India, is very, very psychosocial. So what happens around you impacts a lot to your mental health as well. So if I only stick to one part of what I think should be done, then it kind of is incomplete. So what we do is more holistic. So therapy is much more focused on your psychosocial aspects of mental health than just biomedical.
According to a study by McKinsey and Company, 43% of female leaders are burned out compared to just about 31% of male leaders at the same level. Is that something in your observations that you believe needs to be addressed? Are there any innovative ways that maybe companies as well as startups themselves can look to address these issues?
Absolutely. Women are always at the receiving end of a lot of the burnout at the organizational level, especially because a lot of women end up doing a lot of work that is required to do at home as well as at office, right? So, even when you look at common mental health disorders like anxiety and depression, it seems like women are worse off than men. And there are other disorders like substance abuse where men are worse off, of course. When it comes to innovation, we do a lot of support groups. We've been running a support group, especially for women who were going through divorce, etc. And that has been great for a lot of women. It was a very specific group that we ran for 8 weeks. It was a very specific group that we ran for 3 months, and we wanted to support women. And like I said, we're a very small company. So irrespective of how much we want to do, we have certain constraints and we try to do little bit at a time. And that's why I think that there is a lot of space to do a lot more.
There's also some startling numbers, Rashi, that have suggested that poor mental health among employees have cost Indian employers close to $14 billion annually in absenteeism, as well as lower productivity and even attrition. What do you think can be done, and are you seeing initiatives being taken now by even large corporates to really address mental health care in a bigger way? For instance, we do have HUL as well that has,
Absolutely.
that has some programs that have been announced. A lot of large corporates really seem to be doing this. Is there an increasing trend of that?
I do think that a lot of companies are doing a lot of things. Like, for example, we have helped a number of companies frame their mental health policy. A mental health policy really can guide your vision and mission for the mental health, what you want to see happen in your organization. We've also seen a lot of companies approach us to be their employee assistance partner. We do offer those services where the company is taking charge of their employees' mental health.
So, Rashi, what's the view in terms of a lot more companies now coming into the fray who are addressing mental health as startups? Is there a sense that competition as well here is building up? What is the company doing in order to hold on to market share? How many, overall patients or subscribers, or how is it that you have at the current level, and what's the plan to grow?
Very frankly, I mean, I know this sounds utopian, but I am not very afraid of competition. Like I said, that we've seen companies come, we've seen companies go. One thing that matters, we're not in it to just take market share and keep it. We are mental health users, survivors ourselves, and we do this because it matters to us, right? Apart from that, it seems like in the last 5 years since we have been in the picture, we've grown steadily year on year. We've been doing good constantly. And we are just excited about the future. We have done over, we do around 3 to 4 thousand sessions a year, which for me is a really, really good number. And if that trend continues, I want to be able to do that and just be sustainable. Like I said, that my main goal is to just continue to do good. And that's where we are at, and not worry too much about what it means to have competitors. The market is so large that if we all just do good work in our own spaces, I think we'll be really, really good at it.
Yes, there is a lot to celebrate because we have made a lot of progress over the last few years to really fight that stigma when it comes to mental health care, particularly in India. But as you said, with 1 in 5 Indians really needing mental health support, I think only a fraction has still been done. And would you say we're just getting started and there's a long way to go?
Absolutely. We have centuries long of stigma of services to kind of, bridge that gap. And we're constantly going to work towards it. It's like breaking a piece of rock through and making into a sculpture. It's going to take a time. It's going to take a lot of time. But we're happy to do it constantly, slowly and steadily, constantly keeping chipping away at it. So yeah.
Any tips that you have if you know someone who's going through depression, or as a friend, how to reach out, or a family member? What's the first step, how you can do it organically before you clinically treat someone for depression or anxiety?
I think that it's not a one step, right? If you become a safe space for someone, then you will allow them to come to you yourself. If you've made conversations like depression nahi hota hai, or that only happens to people who are a certain kind of people, it cannot happen if you have a job, it cannot happen if you're married, then it becomes more and more difficult for someone to talk to you. So if you are constantly being nice to somebody and you become a safe space, it becomes easier for the person to come and open up to you. But if you see people around you who are changing, whose behavior changes and it bothers you, always ask. Nothing might be wrong, but they have realized that you have noticed and you are care about them. So the next time something goes wrong, they know they can come.
So those are some of the ways that you can really look to help, becoming a safe space for someone. Rashi, it's been a pleasure interacting with you. Baby steps, lots more to be done, but at least we're making progress on mental health. Thank you.